Good morning. When we approach AI for body imaging, we're going to be discussing today what's the current status, what are the challenges, and what are we looking forward to. As we discuss this, I'd like to keep in mind this construct which was offered by Freibeck and Thornberry when really looking at technology assessment. And in a lot of diagnostic imaging, we have been functioning in these lower three tiers. In AI, we're also right around these early times here. So the ultimate goal is to really see if we can elevate AI and other technologies to have greater and greater impact. What's interesting is AI also has that subcomponent of workflow efficiency, and that's a little bit less related to this traditional construct, but an important capacity of AI. The other element I'd like to bring in is to really be considering artificial intelligence as a predictive technology. Basically, the machines are creating associations and correlations to predict something. And the reason I highlight this is that computers do this very well, particularly in repetitive, tedious tasks where fatigue for humans can come in. But the other thing is that artificial intelligence lacks judgment. And so while we hear often the replacement of radiologists, I do not see in the foreseeable future the ability of computers to execute well the judgment. So I would feel very secure in your positions. This is similar to slides that other speakers have offered, and artificial intelligence is really the branch of computer science dedicated to the development of systems that are able to execute tasks that require human intelligence and emulate cognition. Machine learning is a subdivision of this in which the algorithms can learn without being explicitly programmed. And of the many elements within machine learning, deep learning is emerging as one of the most promising. Here is a chart of the imaging articles produced over the years, and the widths of these colors are related to the number of publications. You can see that CNS publications far outshine anything, and abdomen is a real thin band. So, the question is, why is this?